Okay, this will be a 200 popcorn. Here we go. Now at 200. Now, Mr. Marshall, what did that accomplish? It helped to evaluate her low back. Thank you. And the functions of her lower extremities. Tell us the form of examination. The form tells exactly what you did to evaluate the patient. It entails an oral interview to get historical data, questions and answers. Exactly. Then what? A physical examination observing her movements. Is that all there is? I require her to do different types of bending motions to test her flexibility. Yes. How does this measure her ability? This assesses her motion at all levels in her back. What do you mean by assessing? Determining how each vertebrae in her back functions. What were your findings at this point? She had problems with the joints in her back. Can you elaborate on that a little bit? She had areas which were not moving normally. In what way? In other words, their motion was restricted. Was it on one side that you were seeing problems? No, not entirely. Okay, straighten me out. She had dysfunction at her joints. Where are these joints located? There's a row of joints on either side of the back. Along the spine? Yes, I see. These joints are between each of the bones in her back. Based upon your examination, what was causing the pain? The dysfunction existing in the joints. Doctor, let me back up just for a second here. Sure, that's fine. Were you taught methods of patient evaluation? Yes, I was. That is a part of the physical therapy curriculum? Yes, it is. You do this as part of your practice. Do what? Use evaluations to get your patient's health back? Yes, with every patient. And did you do this with Ms. Escobar? I certainly did. And there was nothing unusual about that? About what? About your evaluating? No, there's not. What were the findings of your examination? As to her problems? Any determinations as to what was causing the problems? Yes, there were. Can you describe them? Limited motion or dysfunction? Where? In the facets or joints in her low back? How can that cause the pain that she complained of? A nerve can actually become pinched in the back. How does this occur? A structure presses on the nerve. This causes pain. And a dysfunctional joint that is swollen can be painful. Where is this pain felt? Along the nerve path. It's called referred pain. Referred pain? Yes. This causes sensations. It can be referred from any structure in the back. You found a basis for the complaints she was making? Yes, she had a neurological exam performed by Dr. Fletcher. Yes, the test showed normal. Now I'm confused. I could not infer the pain was arising from pressure. Pressure where? On a nerve. Is referred pain as real a pain as direct pain? Definitely. Usually more of a vague nature, though. Does referred pain still have a physical cause? Yes. A physical origin? Surely. It's not something that is simply in a patient's mind? Not normally. Is it something that has a physical component to it? Yes, it is of what we call an organic basis. Did you find subjective proof of limitation problems? My subjectivity? No, and Ms. Escobar on that first examination. You're talking about my subjectivity? I'm sorry, any objective findings? Objective, yes. What were those objective findings? The objective findings were the limited joint motion. Explain an objective versus a subjective finding. Subjective finding is something not based on a fact, as opposed to something that can be observed. Objective findings indicate physical evidence. That's about right. This compares to a simple claim of a problem, right? That is correct. You decided Ms. Escobar did need physical therapy at that point, yes. What was the course of treatment that you provided? I felt that she could benefit from physical therapy. I understand that. What treatment did she receive? When I spoke to Dr. Lee, I recommended the back school. And what did he tell you? He said that would be fine. He had no other comments. We agreed to allow 2 weeks' time. Agreed beforehand? Yes, if physical therapy was going to help her. Did you subsequently provide treatment to her? Yes. What kind of treatment did you provide? Treatment consisted of various physical modalities. What's that? Moist heat, electrical stimulation, and ultrasound. As a pain reliever? Yes, also manual therapy techniques for her joints. Let's go through the modalities of treatment. Fine. What is moist heat? Basically a hot pack which is placed on the patient. Okay, she was also getting a form of electrical stimulation. How does that help? That helps decrease pain of the muscle spasm. Now the ultrasound, that is a form of deeper heat. I see. It's given in conjunction with electrical stimulation Did you find that it helped Ms. Escobar? Most definitely. What was her response? She said it did help. How long did you continue with the physical therapy? A couple of months. What progress did she make? She progressed gradually. What type of therapeutic exercise are we talking about? Basically 3 types. Describe them. One is for flexibility, improving motion in the area. The next one, increasing strength. Any other? Some instruction on stabilization. Did you advise Dr. Leah for progress? Yes. Why did therapy continue after 2 weeks? We mutually agreed she needed it. How long did you continue to treat Ms. Escobar? I treated her through August 3rd. You then released her? Yes. Did you see gradual improvement during therapy? Sure did. And did she express relief of pain? She seemed to.